Today I was thinking, doctor, about actually I'm going to speak to you young pediatric dentists, young in the sense of just finishing up school, just out of school, getting your practices going or getting involved in some practice setting, trying to figure out how you want to handle the rest of your career. I want to talk to you because there is a way to make this the most incredible decision you've ever made. There is a way to make your practice the most successful it could possibly be. There is a way to come out at the end of your career with the most incredible group of people who are so thrilled that you went into dentistry you can't even imagine. And that way, very simply, is love. Now you might think, love? What does that have to do with a lot of things? I mean, sure, I love my patients. No, I'm not talking about I love my patients. I'm talking about I love my patients, not as dental patients, as people, as souls, as mothers, as, people who love each other. I'm talking about relationship in dentistry. Some people have called it relationship-based dentistry. I'm calling it love. Here's the deal. Let me give you an example. About a month ago, I was called by one of the GPs in our multi-specialty practice in Abu Dhabi to come and see a 16 or 17-year-old girl who he felt like would benefit from some orthodontic treatment. So I came up to the operatory where this child was, and when I say child, of course she was 16 or 17, so she was a fairly grown-up child, and her mom was with her, and there they both were. The girl was in the chair and her mama was sitting on the bench nearby. So I walked into the room, smiled, introduced myself, happy to see them, walked over to the mama who stood up to greet me, gave her a kiss on this cheek and this cheek, and kind of an air kiss because that's very typically gracious and the way to connect right away with someone in Abu Dhabi. And I said hello to her, and I said what my name was, and then I went over to the chair and leaned down and did the same thing to the young lady who was sitting in the chair. We will call her Fatima. And Fatima was a very delightful young lady with a nice smile, and so once I had introduced myself, I took a look to see what was going on. What I discovered for her was that she had one bicuspid on lower left to right, one side, that wasn't in her mouth. All the other teeth were in her mouth. I didn't know where that bicuspid was. That's not the point of the story. The point of the story is that put her into a very odd unilateral, bilaterally asymmetric occlusion, which couldn't be good long term. Plus she was fairly protrusive in the anterior because her basic occlusion or malocclusion was a class 2. That's not the point of the story either. So I explained to them that we didn't know where the bicuspid was. I explained to them that she could benefit from braces undoubtedly, and that in order to figure out what she would need, the next step would be records. And I explained what those records would be. We scheduled that. I said goodbye, gave another kiss to each of them, and off I went back to my other patients. About a week later, I saw them standing at the front desk in my orthodontic bay area and my orthodontic reception area and said hello. Greeted them again, similarly, gave them a hug this time, more of a hug along with my air kisses. This is the second time I saw them. I'm happy to see them. I'm connecting. I'm loving them. And at that point, they were going to fill out the health history. And I realized that while Fatima's English was quite good because she was schooled in English in UAE, United Arab Emirates, her mama's was not as good, because she was not schooled in English some years back. So the mama couldn't really fill out the health history. And the child was filling it out, but with some difficulty because her verbal English was better than her written and reading. So we got a translator that we have there in the clinic. We have several people that speak English and Arabic. I do not. To review the health history and help with that. Now let me give you a picture of this. Here's mama in her abaya, long black dress, to the floor, and her little shayla, her little scarf that shows just her little eyes, very pretty eyes. Fatima was in her abaya as well, but she was much more modern with it, and she was not covered on her face. And this is not unusual. And so here we were interacting. So we went over the health history. We did the full clinical exam, and I left her with the staff for her records. We have not done the conference yet, although we will soon. Now, here's the point of my story. Not what was going on with her orthodontically, although it was a very interesting situation, which I'm going to love treating and helping her with. It's going to be really fun because it's sort of complex. But what was really the point of the story is that when she finished her records, I came back in to say goodbye and just kind of make sure everything was okay, see if they had any questions. And they didn't, but the mama was saying something that the daughter was translating to me, saying, "My mama loves the way you are." And I didn't know at first. I thought, the way I am? My mama loves that you love us. That's the point of my story. That's the point of practice. Young doctors in dentistry, older, experienced doctors in dentistry, it's all about love. Love makes you more beautiful. Love makes your patients more beautiful. Love is truly where we need to be in today's amazingly complex and changing world of dentistry. Have fun loving your patients and loving what you're doing with them and for them, because they will love you for it. And you'll go home every single evening, even with the frustrations of days sometimes, full of love. I love you, I send love to you, and I wish you the best in you loving your patients. Dr. Chris, signing off.